So how many of you drink water? There you go. And so when you go to your tap, there's probably the presumption that that water is safe to drink. That someone somewhere has treated it, inspected, and you don't even take a second thought about, is this something I should be doing? But one of the questions that interests me is oftentimes our policy for regulating drinking water far outpaces, or is far outpaced by the science, our understanding of what's good for us. And so for one example, let's talk about nitrate. We regulate nitrate in drinking water at 10 milligrams per liter, but there has been this evolving body of science that shows us maybe we should be worried about nitrate at levels that are lower than that, at 5 milligrams per liter. There have been studies done at the research center that I'm involved with, CHEEK, in addition to my time at PPC, that has found correlations with thyroid disorders, birth defects, cancer for extended duration of exposure to 5 milligrams per liter or above in drinking water, even though we don't yet regulate at that level. So you might be thinking, I live in Iowa, I've heard a bit about nitrate, I know we have a nitrate problem, I've seen the Des Moines Water Works lawsuit. How many communities in Iowa are struggling with nitrate above 5 milligrams per liter? So if we look at 2017, those are our community water systems that are serving more than 25 people at a connection that have routinely had measurements above 5 milligrams per liter. And if you drill down into those numbers, that between March and July, on average, we have about 44 community water systems that are serving over 600,000 Iowans that are drinking water above 5 milligrams per liter. But I would tell you, in my own research, that this is a bit of an easier problem to solve because there's a pipe somewhere coming out of a water treatment plant where we can put a widget, something to treat that water and remove it. A peskier issue, and for some of you that have been paying attention to the news lately, is our private well population. So in 2017, these are the number of private wells that were tested through our Grants to Counties program that also had 5 milligrams per liter or above. The challenge with this is that looks like a lot, and it is. It's about 1,400 wells out of, that's 22% of the total that were tested that had nitrate above that level. But that's actually only about 9% that were tested of the total wells we have in the state. So I would argue we don't even know how extensive the nitrate problem might be for private well owners, which are folks that aren't able to rely on a centralized supply. We don't regulate our private wells. So the types of research that we do is we try to develop those technologies to put on the end of that pipe to clean that water. And at the same time, we think about how we can allocate resources we have available to us to help those that are most vulnerable, which are those private well owners. You're going to hear a bit later tonight from Sylvia Secchi, and she'll talk to you about the work we're doing trying to understand programs that can better assist these private well owners. Thank you.